Hey guys, I'm here today again with Kim, one of our medical providers. She is awesome and she is going to take us through what it's like to get a comprehensive exam here at Modoma. So a lot of people don't realize that when you come to Modoma, we are a medical clinic, we're not just a spa. And so all of the medical services that we have to offer you are a way that we stand out, a way that we're different. So before we get started, go to modomamassage.com to get started with your Introductory Massage Package. I'll mention it again at the end. Kim, you want to take us into what a patient might expect whenever they come to Modoma?
Absolutely. So when a patient first comes here, we have them fill out paperwork. And the paperwork is very important because it gives us an idea as to what your past medical history is, what your drug allergies, medication, all of those things. When patients probably first see it, they're very confused as to why the massage place is asking for all of this information. But again, like you said, we are set apart because we are a medical clinic. We are a medical massage. We're kind of an offshoot of physical medicine and rehab. So that is maybe a term that people who know anything about like hospital systems and things like that, that is kind of like a department that we would be under, okay? So first thing is that we expect the paperwork to be filled out completely. And that's more so for your benefit because when we are doing the examination part where we're asking patients questions about their past medical history, we kind of have an idea of what we need to ask based on the information they give us. So things that are definite, like past medical history, things that we need to know, things like cancer, if you have any past medical history of cancer, any sort of irregular heart rhythms or cardiac disease, diabetes, of course. I just like to emphasize on the paperwork, if it's not there for you to click, then feel free to free type everything that's there, okay? And that's really more so for your safety because there's certain things that we may prescribe or recommend that we wouldn't be able to recommend for you if you have certain things going on.
Right.
It also can delay your ability to be able to get a massage if you don't have the right there. So for example, for cancer patients, we have oncology certified therapists who are really the only ones that are able to work on those type of patients, especially if they've had treatment within the past year or two. So that's why things like the timeline of when their disease process was is very important.
Right.
Yeah. Things also to add in the medication portion, we also want to know what vitamins and supplements you're taking. Those are very important because it kind of gives us an idea of what maybe you might be treating with it, and also different medications can have interactions with those.
Okay.
Yeah. And definitely letting us know about drug or food allergies. So that's very important too. Yeah. So after the paperwork is done, the provider reviews it, okay? So we kind of go through it, and then when we come in to see you, we're probably gonna ask you the exact same stuff that you just filled out. Know that we're doing that for your benefit and your safety. We're doing that to make sure, one, that everything that was documented, that we understand correctly exactly what's been going on in your past medical history, but also it kind of jogs some patients' memories. So sometimes they may forget like a medication that they took, or, oh, like 5 years ago I had something else. Those are things that we will want to know usually, and so that way a patient is able to let us know about it. After we kind of go through and verify everything, that's when we do a very focused physical exam. So the physical exam really focuses on your musculoskeletal and your neuromuscular systems, okay? And so meaning that we are trying to figure out, you know, why you're here. Mm-hmm. What is the reason why you're here? Where is your pain? What are you suffering from because of that pain? And so we do certain tests and certain positions and things like that, and range of motion to kind of see really where you're at. After we do that exam, then we are able to come up with a treatment plan. The treatment plan will focus really on three things. Things that we can do for you here in the clinic, things that you are able to do for yourself at home, and then things that we maybe need to watch or refer you out for. So we absolutely do imaging for patients who come in who maybe have new symptoms, numbness and tingling, things like that that need maybe some warrants further investigation because we may need to refer them out. So all in all, your whole entire medical health, like your past health, that can actually impact a lot of the reasons as to why you come in to see us. So a lot of patients may think they're just having like, oh, I just have neck pain, or I have low back pain from this or that or the other, but they may have something else that could be impacting that.
Yes.
So that's kind of what to expect when you come
Awesome.
here and see us.
Yeah, and our whole goal is to get to the root of the problem
Absolutely.
and not just put a Band-Aid on it so it resurfaces later.
Yes.
So thanks so much.
Yes.
That was very informative. You guys can visit modomamassage.com to get started with your introductory massage package. We would love to help you out in any way we can. You guys have a great day. Bye.